Deuxièmement, il n'existe aucun document scientifique prouvant que les psychotropes guérissent le moindre trouble mental.
Since there is no measurement for these psychiatric diagnoses, because they're really just subjective, for the same reason, there really can't be a measurement for the effects of the drug.
In terms of medication, the evidence that's claimed is the medications are highly effective and not very toxic. But actually, in fact, the data in psychiatry are very clear that that's not true. What is true is that the medications are barely, if at all, more effective than placebo.
You're selling drugs to people under false premises, under a disease that's been invented. So how do you measure efficacy among a disease that doesn't even exist?
Troisièmement, les psychotropes camouflent les symptômes tout en créant des effets secondaires graves à court et à long terme.
Whatever problem you're being treated for, whether it's depression, real or otherwise, or cardiovascular disease, medicating away the symptoms is not solving the problem.
The patent medication gives the appearance of having helped because in the short term, it usually doesn't show the bad effects that are going to happen in the long term. So it's very deceptive.
The longer the patient's on the medication, the worse the prognosis is.
None of these medications hit precise targets. You begin accumulating all kinds of collateral damage. In other words, other organs in the body are actually harmed.
So for the first time, we're seeing kids in grade school or middle school who have type 2 diabetes and who have the beginning stages of cardiovascular disease.
So you see Parkinson's disease, you see tardive dyskinesias, you see other movement disorders.
Is it true that we're now seeing a lot of deaths from psychiatric drugs? Absolutely yes.
Quatrièmement, les psychotropes peuvent créer un état de dépendance aux médicaments.
One of the hallmarks of informed consent with psychiatric meds is you have to discuss the potential for addiction.
The vast majority of psychiatric drugs create psychological and physical dependency.
Most patients that I've seen that were on these drugs have difficulty getting off of them. It's rare for somebody to just be able to stop it without a problem.
Cinquièmement, la plupart des troubles mentaux proviennent d'une maladie physique.
Many physical conditions can cause mental problems or what pose as psychiatric symptoms, but the psychiatrist, in the records I've reviewed, psychiatrist does not do an in-depth study of what could be causing the problem.
And if the doctor isn't taking the time to find the cause of those symptoms, then unfortunately those symptoms may continue and there may be a serious underlying medical disorder that's being overlooked.
The question is it better to treat depression with a drug, or is it better to treat depression by trying to figure out what caused the depression and working it out with the patient?
Dehydration can make you exhibit symptoms of depression. Sleeplessness can make you exhibit symptoms of depression. Eating a terrible diet, hypoglycemia, being sedentary, all of these things are biological reasons for having symptoms of depression.
I have in my practice children who are misdiagnosed as having ADD, ADHD, who really have Lyme disease.
70% of all what are classified as mental illnesses actually have a physical cause, a physical problem causing that.
Sixièmement, quel que soit l'état émotif ou psychologique d'une personne, il existe des méthodes alternatives efficaces qui ne comprennent pas de psychotropes.
Once you've proven that there is no problem in the body and that there is no malfunction in the brain, then you have to begin to address these other levels of the self. And I think that's what psychiatry has completely stopped doing.
There are very few conditions that cannot be treated by other methods than the use of drugs.
Any forces that impinge on medicine that make us think that the drug approach is the only approach is undermining good patient care.
Et comme le patient est rarement informé de l'existence de la plupart des méthodes alternatives non médicamenteuses, il ne consent presque jamais à un traitement en toute connaissance de cause.
When you get into informed consent, it's almost a responsibility of the patient to make an inquiry about the hazards of the drug and not rely on what the psychiatrist or physician tells them.
We can't go in and abdicate our responsibility as consumers simply because somebody has an MD after their name or someone is a psychiatrist and we think they know more than we do.
The best way to protect yourself is to educate yourself, is to ask questions not only of your doctor, but to do your own research.
Don't be ignorant, be informed. Get information from as many places as you can. That's how you'll be an intelligent, skeptical consumer, and that's how you will protect the safety of yourself, your children, and your entire family from this industry of death known as modern psychiatry.
De même que la psychiatrie s'est infiltrée partout dans la société au cours des 50 dernières années, il en est de même du dopage de psychotropes. Mais il existe un moyen de dénoncer ces mauvais traitements médicaux en rapportant tout sujet de plainte et tout effet secondaire des psychotropes auprès de votre Agence nationale de contrôle des médicaments. Aux États-Unis, l'agence fédérale MedWatch. En France, l'AFSAPS.
MedWatch is a voluntary reporting system, a passive reporting system where doctors, patients, healthcare providers, pharmacists, anybody really can make a report saying that they think that what they experienced or what their patient experienced was an adverse drug effect.
And this is what we call post-marketing surveillance. And this begins to get a look at what the side effects of long-term or chronic use of these drugs really is.
The FDA admits that probably only 1% of all the adverse drug effects are actually reported by patients or physicians.
Ce n'est qu'en rapportant tous les effets néfastes des psychotropes que l'on fera connaître l'horreur que constitue le fait d'être dopé à coups de psychotropes. Les faits vous ont été donnés. Montrez cette vidéo à votre médecin et ne permettez pas que vous, vos amis et ceux que vous aimez soyez les prochaines victimes du marché très lucratif des psychotropes. Pour en savoir plus au sujet de la psychiatrie et des prescriptions abusives de psychotropes ou pour rapporter les mauvais traitements des psychiatres, contactez la Commission des Citoyens pour les droits de l'homme.